and you are set to begin.
Great. Hello, I would like to welcome you to today's webinar, Evaluating Two-Generation Approaches, Integrating Partnerships and Embedding Equity. Let's advance to the first slide. I am Kentayani Murray, a Senior Research Associate with the Research Evaluation Evidence and Data Unit at the Annie E. Casey Foundation. I will serve as one of the moderators for today's webinar. We are excited to share common lessons learned from two recent two-generation evaluations of the Annie E. Casey Foundation's Family-Centered Community Change effort and the Agape Child and Family Services in Memphis, Tennessee. These evaluations help to add to the growing evidence base around what we know around two-generation approaches. Partnership integration is a key component of two-generation approaches, and what these evaluations reveal can inform new and ongoing efforts. Our current collective national reckoning with racial justice makes the lessons learned around embedding equity particularly crucial for the current moment when so many of us are leaning into equity-focused, transformative shifts in practice and are searching for data and information that can inform new and ongoing efforts around equity. Let's get started with a review of the agenda. Following a few housekeeping notes around communicating during the webinar, I will introduce our presenters. Next, my colleague Allison Holmes will provide brief background information about two-generation approaches and the evaluations that we are highlighting today. Next, for each theme, Allison and I will provide an overview followed by a discussion from the panel. We will have time for questions from the audience and will conclude with resources for learning more. We can move to the next slide. I want to take a moment to go over some important housekeeping details for the webinar. After we hear from our presenters, we will have some time for questions. We will keep webinar attendees on mute throughout the webinar. You may ask questions during the discussion. We ask that you submit your questions by entering them in the Q&A window, which you can see circled on the slide. You'll find that window at the lower right-hand corner of your webinar screen, and you can submit a question there to the panelists. If you are in full screen mode and want to ask a question, you may need to return to the event window by using the drop-down controls at the top of your screen. I will also mention that this presentation is being recorded, and the recording and the slides will be available later at aecf.org. Okay, we can move to the next slide. I'd like to introduce our panel. The first row in the slide are the members of the Family-Centered Community Change panel team. First, Tanja Jones is the Nextdoor's Community Support Coordinator with Community Properties of Ohio and representing the Columbus, Ohio Family-Centered Community Change, or FCCC community. And with the evaluation team, Susan Popkin, Director of the Host Initiative and Institute Fellow with the Urban Institute, and next, Marla McDaniel, a Senior Fellow with the Urban Institute. Moving to the panelists on the second row, we have Paulita Edmondson, a Family Connector Supervisor with Agape Child and Family Services, and with the evaluation team, Tosi Shabanjo, a Human Services Research Analyst with Mathematica, and Kimberlyn Butler, Director of Foundation Engagement at Mathematica. Before the distinguished panelists come before you, we'll have my colleague Allison Holmes, who will lead us in the next segment of the webinar. Allison?
Great. Thank you so much, Kentayani. I am Allison Holmes. I'm a Senior Research Associate at the Annie E. Casey Foundation. And before we get into learning more about the projects today, we wanted to hear a little bit more about you. So we wanted to do a poll, which should be popping up, and here it is. And we wanted you to select which category best describes you. Are you a funder, a community member, a practitioner, or a researcher. And you'll just select which one, and we'll leave this up for just a little bit longer so we can get a better sense of who has joined us today for this really engaging discussion about evaluation in the two-generation field. I'll just give this some time as everyone submits their answers. Seeing those come in. We have a lot of folks with us today, and we're really excited that so many have joined. And I know there are others who are not able to join. There's a lot that's happening today, and others may be watching this recording later. So that will be exciting as well, because we can continue these discussions, and hopefully it will spark more discussions, again, with the panelists and in the cohort that we have here as well. All right, so it looks like our poll has ended. And here are results. So we have a lot of researchers with us today. That's great. So we've got 47% researchers, 26% practitioners, 14% funders, and 8% community members. So a great mix. Wonderful to have all of you with us. So thank you so much, just so we can see who is here, and really looking forward to the discussion, both with the panel and with you. And as Kentini mentioned, throughout the discussion at any point, please feel free to put your questions into the Q&A box. Great. So we wanted to give you a sense of how the Annie E. Casey Foundation approaches its work. The foundation focuses on strengthening families, building stronger communities, and ensuring access to opportunity, because children need all three to succeed. We advance research and solutions to overcome the barriers to success, help communities demonstrate what works, and influence decision makers to invest in strategies based on solid evidence. We make investments that encourage a focus on quality research and evaluation to learn what ideas and approaches are most effective for improving the well-being of children, youth, and families. Two-generation approaches are largely poverty reduction approaches that intentionally integrate services provided simultaneously to parents and their children. This takes on a holistic or whole family approach to help families achieve financial stability and well-being through a variety of services, such as job training, financial coaching, or other types of coaching, early childhood education, housing, mental health services, parenting supports. There is not a singular configuration for a two-gen approach, and it can be tailored to the needs of the families and the community context. This approach aligns with Casey's focus on strengthening families and communities, as well as accessing opportunity. Two-gen approaches are all about connecting families across the programs to meet their needs, connecting the staff who are delivering services to parents and children, and connecting the data necessary for successful implementation. Recently, we've seen a more explicit shift in the field as part of two-gen approaches to focus on the underlying systemic racist structures and policies that are keeping families in poverty, as well as more awareness of individual bias in social service provision. So really what we're talking about is a shift from a focus on individuals in isolation, parents, children, staff, community partners, to a more holistic picture of how people and organizations are connected within context. And today, we'll hear about a few examples of these place-based approaches. Our first examples come from the Family-Centered Community Change, FCCC, initiative. The foundation partnered with 3 two-gen approaches in 3 cities: Buffalo, New York, Columbus, Ohio, and San Antonio, Texas. Each approach was unique and tailored to their community, and the foundation offered technical assistance, various trainings, and a peer learning cohort as all approaches grew and evolved. There was also a co-constructed evaluation component conducted by the Urban Institute. Next slide. This included a longitudinal implementation and process study to capture how the approaches were rolling out, as well as a descriptive cost study. Data collection involved multiple sources and methods, including interviews and focus groups with participants and staff, program data, and staff time to estimate the cost. Our second example is the 2-gen model at Agape and Child Family Services in Memphis, Tennessee. Similar to FCCC, they offer community-tailored programming and serve families in schools, apartment communities, and churches, places for families naturally gather and feel safe. Families can enter programming through any service and are able to guide their own path through the other services that are available. A process evaluation was conducted by Mathematica to capture how participants experience the programs, the benefits, and the opportunities for growth. Data collection involved multiple sources and methods, including interviews and focus groups with participants and staff, as well as program data. And now I'll turn it over to Kentayani to discuss some of the common themes across the evaluation.
Thank you, Allison. Recognizing the role that inequity plays in the community's economic and social conditions, both Family-Centered Community Change, or FCCC, and Agape developed and implemented efforts to embed equity in their work. While FCCC and Agape use different strategies, there are some common themes around embedding equity found in the evaluation. The first theme is around centering families. Both Agape and FCCC held the principle that centering families by including their voice in program design and decision-making is an important equity strategy. In this way, inclusion was seen as a key driver of equity that is more authentic and empowered participation from families would mean more equitable processes and outcomes. Indeed, centering families was thought to increase family participation, which could better support positive change. However, the evaluations revealed that while centering families was viewed as core to the work, it was challenging to put into practice. Another theme is that embedding equity strategies can be an important tool for tackling structural and contextual community challenges. And related, engaging families in program design and decision-making and giving attention to those structural and contextual community challenges are complementary practices. The manifestations of racial and ethnic inequities, such as poorly resourced schools in the communities, disinvestment in community infrastructure, volatile housing, rents, and low home ownership rates, and poor access to reliable transportation, contribute to the economic and educational challenges families face. Addressing family engagement and the structural and contextual challenges is a more holistic approach compared to a focus that disconnects people and organizations from those contextual factors. Next slide. Lessons learned surfaced by the evaluations included: first, investing sufficient time to engage and include all stakeholders in the processes of the equity effort, especially if you are including individuals such as families who have not been included in authentic and meaningful ways in the past. For example, it will take time to develop inclusive processes and build trust across new partners. Next, the importance of creating shared definitions and language is another lesson learned. Terms such as racial equity, inclusion, and structural racism can be interpreted in diverse ways. Thus, this is a way for stakeholders to have a common understanding of key terms and concepts and to provide level setting. Investing in ongoing training and learning opportunities is a way to build knowledge about race equity tools, explore potential strategies for their use, and support action planning and continuous improvement efforts. Also, these are important spaces to create and reinforce shared definitions and language. Other lessons include knowing your audience and how to frame their roles, collecting and using data as a way to track progress and identify areas in need of improvement. And finally, starting with the lead organization as a model for others, which can strengthen efforts to make the case for embedding equity and increases buy-in. We'll now move to the question and answer portion for embedding equity, the questions that we have planned in advance, but again, you can use the Q&A feature to ask any questions as we move along. We may be able to integrate some of your questions in this segment, but certainly we will try to make sure that as many questions are answered as possible as we move to the last question from audience segment. So I'd like to ask Paulita Edmondson of the Agape panel team to address this first question. What is an important consideration for other initiatives that aspire to include families in design and other decision-making roles?
So for Agape, it is important to really focus on building that relationship, especially in this virtual environment. And we do that by honoring our voice and choice. So we have surveys that we send out to families. We have community cafes, and that is where we hear our community needs. Tosi also has something to add to that.
Thanks, Paulita. So Paulita just mentioned at Agape, it's critical to respect families' voice and choice. And broadly, Agape's voice and choice framework allows families to choose if they receive services, which specific services they receive, how and when. And through our implementation study, we learned that from our conversations with staff that tensions can arise between trying to promote families' role in decision-making and trying to elevate voice and choice, while also trying to promote high participation in services and take-up in order to help families meet the goals that they set for themselves. So with that, through our study, we recommended that it was important to intentionally focus on training frontline staff or the connectors at Agape in not only elevating voice and choice, but also understanding how to promote participation. And one specific recommendation that we had was focusing on motivational interviewing as a way to respect families' voice and to respect their choice, while also energizing them around goal attainment and also encouraging them to meet their goals.
Thank you, Paulita and Tosi, for sharing those perspectives and lessons learned from the Agape experience. I wanted to turn to Tanja from the FCCC work in Columbus, Ohio. Can you share what you think are some important considerations for other initiatives that aspire to include families in design and other decision-making roles?
Absolutely, and good afternoon, everyone. One of the things that we have found is bringing families to the table as soon as possible when implementing a service or resource. It puts the program on the trajectory of being successful, having buy-in, and the families usually commit to the program. One of the things I would also share is don't just bring the families to the table, but respect the information that they are sharing because they're the expert in their lives and in their situation. I would also encourage the practitioners and those individuals who are starting initiatives to handle the information that you receive from the family with respect and integrity, and make sure that when the families are at the table, that it is a table of equality, that all are equal at the table. Be mindful of our personal biases, make sure we have open dialogue, no judgment, and seek to understand, because then we can then put together a program that both the families and the professionals can move forward.
Great, thank you for that perspective from your work. And we have a question that came in from the audience that relates to the considerations question here. Do you find it better to separate youth and family into distinct youth or family councils or youth or family focus groups? I'm wondering if someone from either team could speak to that experience, and if not, maybe just speak to a particular barrier generally to centering families or a challenge to centering families that you've encountered in the work.
I can say that I found it extremely important to separate the children and the parents when doing things such as community cafes or when having different forums, because the parent and the child have different needs. And in order to hear them, we need to separate them. There are times when children may feel more comfortable speaking to their needs when their parent is not involved. And we've been able to get a lot of good information when having those separated and then bringing them back together to do that full wraparound service for them.
I would agree. We in Columbus, we try to use both approaches, not either or. We have family gatherings where we intentionally bring the families together to work on whatever is going on, do fun activities, family building activities. We also plan programming where the young people are with them. They're able to be separated from the parents. We also in Columbus make sure that we have allowed the families to have one-on-one time with each coach. So if one of the young people or teenagers want to have one-on-ones with the coach, we set that. So we focus on the family, we focus on the adult, and we try to put equal emphasis on child interaction as well, or youth interaction.
Thank you for sharing. It sounds that in both cases there's this push to make sure that you're being responsive to the needs of the families and youth, parents, and creating different experiences that can really elevate that work to center families. We can move to the next question. I think we'll have plenty of opportunity to talk about challenges. The next question is, what are barriers and opportunities for organizations to model behavior that furthers equity? And let's begin with Kimberlyn from the Agape panel team.
Good afternoon, everyone. Thank you so much. So I'll respond to this question by saying that we all know that our communities deserve the best. They deserve the best in service delivery and really all aspects of engagement. And there are so many systemic already at play that we spoke about earlier in this conversation. So first, we need to check our assumptions about diversity, equity, inclusion, and cultural competency. And we need to be explicit about how we center that in our organizations. One of the things I'll lift up is that it's important to consider equity when hiring and ensuring that frontline staff can be really empathetic towards clients or those that are beneficiaries of the services that we're providing because of the shared experiences and identities that they already bring from the community. So, for example, in 2Gen, most connectors at Agape, like participants, are Black, and some have experience living in poverty or lower income communities. Yet in this work, it's really important to understand that shared experiences and identities will not automatically lead to an understanding of how to deliver equitable services. So there can be a disconnect there. We learned in the study that for some frontline staff in 2Gen, they may not automatically understand or be able to identify root causes or systemic issues related to the challenges around service delivery, such as low participation. With that said, earlier on, organizations are now hiring direct service staff with shared identities. So they should also be seeking to explicitly discuss racial equity and inclusion with staff and interrogating their own literacy and cultural competency. So I think it's really important that research firms also understand and censor racial equity in their evaluation practices. I know at Mathematica we've launched an equity community practice, so we'll invite some of our other research colleagues to be doing the same so that when you partner with providers and you partner with foundations, you really understand what that looks like. And then finally, I'll talk about just the importance of checking language and avoiding deficit language. We hear that a lot, but I think it's very important to think about how you center the practice to promote equity and asset framing and how we refer to those we are providing services to. And then just one more final point, organizations not engaging programs and community partners to create a shared agenda. That's really important. There's an assumption that these issues can be solved in a vacuum, and really we need to be partnering together and engaging everyone in the same agenda. So Paulita, I'll turn it to you because you have some really good examples.
Thank you, Kimberlyn. And so, as you stated, cultural competence is extremely important, but we also like to really hone in on cultural empathy. I know for Agape, it's really important when you are working in that community to embed yourself into that community. And so joining things such as the community advisory boards, we've started parent support groups, attending those neighborhood watch meetings. Those are all really important things to do to really gain that cultural empathy along with cultural competence.
Thank you. Those are all really wonderful and crucial insights. Really appreciate just understanding that there can be one strategy that's important, but it may not be sufficient, that it really takes strategies on all fronts, from hiring in ways that elevate shared lived experience, to having an equity-focused evaluation, to having norms around avoiding deficit language are all really important for elevating equity. I want to turn now to the FCCC team. Sue, can you respond to this question and share some perspectives from that initiative?
I think we've heard a lot of great strategies and things to keep in mind, and I think I'm going to talk about barriers because that's part of the question here too. And I think when you're thinking about the kinds of entities that are, or organizations that are implementing two-generation initiatives, they're nonprofits, they have a lot of funders, they have different imperatives that they're responding to, and doing the kind of outreach and intentional work that you've all described takes time, it takes effort, and they may be strapped for that kind of time. They may, I think the staff and leadership generally agree that equity is important and that they want to do these things, but in practice, they may be so strapped trying to serve the clients that they're serving, or to keep their funding, or to get their reports in and do the performance measures they're being assessed on. I think, so I think in order for that kind of activity to be sustained, or the equity focus to be sustained, that needs to be built into the funding system or into the incentives they have.
Thank you, Sue. And that what you're reeling from the FCCC experience is a great segue into the last question that we have planned. What should a program or initiative focus on in the early stages to embed equity in their work? This is particularly relevant to organizations that are thinking about or planning efforts to embed equity. So Marla, from the FCCC team, can you respond and share from the FCCC evaluation?
That the trainings were helpful for establishing some shared level of knowledge, language, and space for some of the staff and family members who participated to actually begin grappling with these issues. To answer the question about what a program or initiative should focus on in early stages to embed equity, three things come to mind. First, if you have an opportunity, it's probably worth the investment to bring in trainers to actually consult third-party neutral experts to help your initiative or community truly understand what embedding equity means. Definitely, number 2, include all staff at all levels, from leadership who may not work directly with families to frontline staff who do, and also families. And then third, to focus on this work, the education and the training from the very beginning, including figuring out how to create the space, especially safe space, for staff of all levels of power and authority, and also family participants to be able to discuss, speak from their hearts and minds, and to truly contemplate what equity means and entails. And then definitely be ready to identify and create a clear plan for embedding equity, whether through hiring or reevaluating decision-making structures or something else. And I'll also add, lastly, that even with the trainings, definitely expect challenges. In FCCC, having 1, 2, even 3 or 4 trainings wasn't always enough, especially to the extent that none of the trainings could fully include all staff at any given point in time. So we definitely heard that participants felt there was much more to learn to translate the trainings, especially into practice, and that staff turnover and change also meant that new staff wouldn't always have the same grounding. So planning from the beginning for ongoing training and knowing that it's an ongoing investment.
Mm-hmm. Thank you for sharing those insights, Marla. And I wanted to flag for you that the first statement that you were making was something about training before you started into this question. There was something off with the audio. I couldn't hear you. So if you wouldn't mind repeating just the statement you made before
thank you.
Transitioning. Yep.
I don't know. Maybe it was just indicating that midway through FCCC that the communities and NEKC supported the communities in having actual trainings. I don't know if that was the point.
Yep, I think that one didn't come across, which is really great context for your response. Yes.
Thank you for letting me know. Yeah, so there were actual trainers, and so the first recommendation to actually, if you can, in your own initiative, invest in a third-party trainer. I think that was one of the lessons that came out pretty clearly in FCCC as being useful.
Great, thank you. And Atosi, can you share from the Agape 2-generation experience, and then Paulita, feel free to follow up with your practitioner perspective.
Yeah, definitely. So there are 3 examples that I'll give from our Agape implementation study related to this idea of what to focus on early on. And so I think broadly it's critical for organizations to consider how they can structurally embed equity in their work by weaving in strategies foundationally. So for example, Allison was mentioning how place-based services reflect what Agape does. So they deliver services in apartment communities or churches or schools. And so they're literally meeting families where they are. And so that's one strategy to embed equity within the foundation of the 2-gen paradigm. And the second example that I'll give is the voice and choice framework that we discussed early on. So that is a structural framework, a process that Agape uses to make sure that families' voices drive the services that they receive. And then the third example that I'll give from Agape is a no wrong door policy they have, which again is a formal structured policy that ensures that families can enter the 2-gen program through any of the programs that they offer. So there's no wrong door for entry. And so this is an example, I think, of how an organization can develop formal structures or policies that can help them embed equity in their work. And Polly, I'm not sure if you want to add on or offer some more examples.
So yes, Tosi, thank you. I think that for Agape, what's been really helpful embedding equity early on is it starts in the interview process. When a candidate is selected, we do a bus tour, allowing them to go through all the areas that we serve. They can see firsthand the communities that we are in. As Tosi stated, we are place-based. So the communities that we served, we're set up in churches and apartment complexes there. That's where our offices are. And so candidates who are applying get to see that. They get to see, you know, the neighborhoods. And so when I was hired to work for Agape, the area that I was going to work in, I had to do research on this area. I had to learn about the people. I had to learn the churches and the businesses and what's there. And so that was very helpful, understanding the resources available and what was going to be needed in there. And that was something that was done early on so that I was able to understand what families I was going to serve would be needing.
Thank you. These are all really phenomenal responses and great advice to other organizations. We had a question that came that is relevant to the last two questions, and I wanted to see if any of the panelists would respond for a minute. What might it look like to build that funding, build embedding equity into funding requirements? Sue, I think you had mentioned that would be something important for communities to think about and lead organizations. Any perspective from any of the panelists about what that might look like, or any other advice related to building embedding equity into funding requirements?
I can help. Okay.
The fact your foundation does with its grantees, that giving them people have to get performance measures they have to achieve, and one of them should be around equity. You know, different on the different situations, but around the teams who are implementing the work, for if it's a group of researchers, or are you using a community engaged approach if it's a group of researchers, and I think the same for local nonprofits in terms of the teams, or are you doing training, or I think, you know, you have to have some specific measures that you define, and then people will respond to what they're being, I mean, we all respond to what we're being graded on, right?
I'll just add, I think it's important for those foundations willing to do it to take a more participatory grant-making approach, where you are really centering the voices in the communities to actually sort of co-create the investment opportunities, bring them to the table to think about how those investments will actually play out in their communities. Funders know that you have tremendous convening power and the ability to be catalytic in nature and to really move the needle. And so asking grantees or prospective grantees early on how you'll center equity, and then having them sort of, partner. I know Allison and Kentine are very passionate about measurement, evaluation, and learning. Like, how do you sort of know you're doing that well? How are communities better off? And there are a million frameworks out there, including the results-based accountability frameworks and others, to sort of center racial equity in your investments.
Thank you, Kimberlyn and Sue. And I think that both your comments really speak to as well how the funder or the lead organization can model that equity focused behavior. So thank you, panelists, for your dynamic and informative discussion around embedding equity into generation programs and the lessons learned from your two initiatives. I'll now turn the presentation over to Allison, who will lead off the Integrating Partnerships and Data panel discussion.
Great. Thanks, Kentine. Those were really powerful examples and such great discussion. So we want to turn now to another common theme from the evaluations, integrating partnerships and data. So integration is the hallmark of a two-generation approach. So across the evaluations, we found that intentional integration across programs, services, and partners creates a more seamless and whole family experience. That integration work behind the scenes pays off for a qualitatively different experience for families, particularly compared to other social services they may have received where the family perspective and voice is not centered. And achieving that integration requires explicit communication strategies such as recurring meetings or internal policies among staff, and can be facilitated by locating offices together, which allows for informal sharing of information and referrals outside of those regular meetings. Sharing program data among staff and partners can also serve as a communication strategy in addition to tracking program implementation and family progress. A solid data system or coordinated many data systems is necessary but not sufficient. This communication aspect of data integration requires planning and intentionality with what data is collected, who sees it, and how it is shared. Those data governance decisions are outside of the data system itself. So what have we learned? Well, aligning culture and practice to shared goals among partners is necessary and moves at the speed of trust. This step is critical and it cannot be rushed. Greater understanding among staff about the 2-gen approach means greater connection among services. Everyone needs to understand the overall vision, their individual role, and how all the pieces fit together. Then they're able to guide families to appropriate services, allowing for more integration across the program. A no wrong door approach helps bring families in and requires a balance for staff and data communication. So this reduces repeating the same information at a repeated intake, double entry for staff for the same information. So you're creating efficiencies both for staff and families, but that takes planning. Improving data systems and data alignment requires staff training and support. Again, this is an opportunity to create efficiencies in the long run, as long as you've put in that front-end work. Who is trained, what type of training, where support can be accessed, and you have to be able to maintain that over time. Plans for retraining, continuous quality improvement, support sessions, and so on. But let's hear from the panel about their experiences. So first, what feedback mechanisms work best between frontline staff and leadership, both within and between programs? And I wanted to turn this first to Tosi and hear how what they learned from Agape.
Thanks, Allison. So at Agape, their staffing structure really helps to facilitate integration. So specifically, they have the connectors who are the frontline staff that deliver services, and they have clinical therapists, and then they have supervisors, coordinators, and then program directors. So it's important to facilitate communication and feedback within and among these groups. And so we learned that there were 3 specific examples of feedback mechanisms that help to promote integration. So the first, which Allison, you just spoke to, is the importance of having shared spaces. And so at Agape, for example, frontline staff deliver services within the same spaces, which allows them to provide feedback to each other, but also it allows their supervisors or their coordinators or even directors to be able to provide feedback. And the second example we learned, which is related to this, is having open door policies. And so frontline staff spoke to the importance of being able to go into their supervisor or coordinator or program director's offices to share challenges that they're experiencing and receive support. Then the third example that I'll talk about as well is having structured spaces for cross-program staff to meet. So at Agape, we learned that they have twice monthly multidisciplinary team meetings, and they have weekly devotionals where staff from all of the different programs come together and they can share challenges that they're experiencing and elicit feedback from their leadership and also from their fellow peers.
Thanks, Tosi. Those are really helpful examples, especially those nice structural things that are built in. Paulita, was there anything you wanted to add to that?
I will. Thank you, Allison. And so at Agape, we really foster like a family environment. Our upper leadership is very intentional about gathering information from frontline staff or from leadership on down. And so what they do with that information is they gather the data, then we come together and they provide us with what we ask. I think it's very important that there have been times where you can have a conversation in the break room with David Jordan, our CEO, perhaps the busiest man at Agape, and then to hear him bring something up that you discussed in the break room, to bring that up in vivo shows that he's listening, that he cares, that he wants to, assess your needs and to help you. And so I think that's important. Our open door policy, if you were to walk through our office, you would not see any closed doors unless there was a personal meeting. Those things are really important to have that between frontline staff and our upper leadership.
Thanks, Paulita. It's really helpful to know about that personal connection that you have across all the levels within the organization. Marla, was there some examples you wanted to share from FCCC?
Sure. I'll start by saying that there are many similarities between how FCCC did this and Agape. So I'll just highlight some of them. I would say that all three of the initiatives in FCCC, they established formal mechanisms and opportunities to communicate within and across partnering organizations and among all levels of staff. In FCCC, the initiatives used meetings, co-locating services to not only make it easier for families, but to also make it easier for service providers to interact with one another. In terms of what worked best, co-location was definitely reported to be very helpful. We heard that consistently when we talked to community members and staff. Second, program data was also helpful. Program staff tended to see the potential of shared data, and all three initiatives were able to use it in some ways for tracking and modifying programming. I would say the promise of sharing data never lived up to its full potential due to various challenges that differed for each initiative, and we could go into that. But the third thing I want to highlight, though, is that there was something pretty unique about the initiative and the role that the NEKC Foundation played in the FCCC communities that involved annual meetings for teams of sometimes between 10 and 15 staff across levels, and including 3 or so family representatives coming together, always in a different city, typically even outside of the 3 FCCC cities, for a week-long retreat to meet and discuss initiative goals, lessons, and findings. So this often prompted a focus on topics that the initiatives would then take back to their communities. For example, a focus on how to engage families more deeply in decision-making, a focus on communication strategies and how to tell the story of FCCC for other audiences, including policymakers and funders, and doing what we at Urban Institute call data walks. Or during those meetings, we would often present sometimes preliminary numbers or intriguing patterns, and in mixed teams of staff of all levels and parents, all in small groups, we would walk around to each of these posters of data that we would put up around the room, pre-COVID, of course, to discuss interpretations from each's critical vantage point about what those numbers or patterns might be reflecting. So this group sense-making of the numbers and findings. And I highlight that to emphasize that it was also a great mechanism for communication between frontline staff and leadership and parents. It kind of leveled the ground, and each were learning from each other's perspective, and so there tended to be very, very enlightening opportunities for communication.
That's really great. I love hearing the power of data and changing things, especially across roles. So thanks for sharing that example. Let's maybe move to our next question. How did partnerships with local and state entities support these structured data to support these place-based approaches? Sorry about that. And we'll turn this over to Sue first.
Okay. Well, I wasn't going to talk about how the partnership and not so much the data, but in San Antonio had a real advantage in this situation because the partnership in San Antonio was made up of large civic at the city level organizations that mostly were used to partnering with each other and had experience doing it before, and that brought a lot. And they actually had experience partnering with the Casey Foundation before. So they brought that experience to the table. And the backbone organization was the United Way of Bexar County, which is a funder of many of these organizations, but also a convener. So having that structure meant that they were able to partner together, they could work together better. It still took a long time for them to learn to figure out how to share data across organizations. That didn't happen until towards the end of the project. But it left them in a really great place for sustainability because they could basically fundraise together going forward as a partnership and access the resources of all these different entities. And I'm going to turn it over to Tanja to talk about Columbus.
In Columbus, we started pretty much at the front line. We know that, getting to the state level and the city level can be a little challenging. So what our focus is that we all try to come together, the front line staff. We came together, we created what is called a family focus meeting, and that's when all of the partners, frontline partners, came together. And then what we asked each partner to do is to go back to their entity or to their agency and share the information and to try to get, some buy-in and feedback so that we could move the family forward. And what started to happen is as we all started to share information with our organizations, we started to get the attention of our leaders and higher up organizations. One of the examples being the Columbus City Schools. We started out with just working with the teachers and the principals, and now we have the attention of, I want to say, the second or third person in control at Columbus City Schools. So we really started focusing on the frontline local, and were able to get the attention of the next levels.
Thanks, Tanja. That's really, really helpful to understand. Maybe let's hear from the Agape team. Kimberlyn, did you want to share some examples about partnerships with local and state entities?
Yeah, sure. I just want to shout out Marla for mentioning data walks because I think it's really powerful that we lean into the opportunity we have to democratize data and really engage partners and communities in the narrative change process that's really more aspirational. So taking the opportunity to hone in on disaggregated data through data walks and how we'll enlist them in concretely partnering to eliminate disparities is really important. I was also asked to quickly comment on what I meant by asset framing earlier, and I just want to say that is also a part of narrative change. It's defining people by their aspirations and not their challenges. So we shouldn't be saying low-income children or youth, but instead youth experiencing poverty because they didn't choose the circumstances that they find themselves in. We know that it's inequitable systems, as Allison and Tiny mentioned earlier, that are more responsible. So we're grateful for programs like Agape and FCCC, where clients have a voice and a choice in partnering with practitioners to access their most promising future. On the partnership side, though, I think it's really important that the partnerships reflect clients' needs. So in our study, one respondent described accessing or assessing the synergy when developing partnerships. The person specifically said that they used a profile document to capture several details about potential partners, including their specific needs, the vision, the mission, and opinions that they have about collaboration. So using this information, the director mentioned that she could detect a synergy by assessing alignment between partners and Agape's mission and goals. So if that synergy emerged, the respondent said that the partner could then be welcomed into what she called Agape's strategic ecosystem. Another thing I want to mention is that 2Gen staff deliver direct services, but they also collaborate with the state, local, and national partners to support clients. But most of the partners are local. So supporting and complementing 2Gen services reflecting on the client needs. Agape actually has 100 partnering agencies and institutions to provide services. And so thinking about how all those partners work together and like the unique roles that they play and being intentional is really important. Finally, I do want to say that funders really do play a key role in this. They need to be thinking about investing in 2Gen programs and orientation to build that evidence base that Allison talked about. There's a role to mobilize networks and influence and advocate for the expansion of public funding around these programs, and consistently investing in research and evaluation to innovate for the future. And then finally, playing a more coordinating role, or at least catalyzing coordination among existing services to support 2-gen programs. I'll turn it over to Paulita.
So I would like to say that just like Tanja, we do form those partnerships on the front line. We allow our clients' needs and desires and their wants to drive those partnerships. And so we gather that information from things such as our surveys and the community cafes and our parent support groups and our forums. And from that, we are able to hear what they need. And so then my staff go out and try to find those resources. So for example, we had a client who was attending all of our women's empowerment groups and parent support groups as she was coming. And so then the need was credit repair. And so we partnered with the GMFEC and got her a credit counsel. And with all of the resources that we were able to provide, CSA, GMFEC, CSA, this client was able to get housing within a year. And that came from those partnerships. Not having that, not having those resources there, she would not have been able to own her own home within 12 months.
That's fantastic. The power of partnerships right there. Thanks, Paulita. So we've had several questions come in about how everyone has been adapting and shifting things in response to the pandemic. And we're just mindful of time. And we wanted to kind of turn that question over to Tanja and Paulita, and thinking about, we've been talking about all these different aspects of both equity and integration and feedback mechanisms and all of that, but we kind of wanted to shift that and see, get the response kind of on the ground, how that's been looking in the current circumstances and everything that's been happening. So Tanja, I'll start with you. If you want to kind of give some reflections about how things have been happening recently in response to the pandemic in your work.
I will have to say, although it has been very challenging, we have found that families have been more engaging. And this is one of the reasons why is when the pandemic started, we wanted to make sure that they felt supported. We wanted to make sure that whatever resources and services they needed, that we had an opportunity to provide those. So we intentionally made it a point to reach out to our families. We try to reach out to them bi-monthly, like every couple of weeks, but we made it a point to reach out to our families weekly. And in doing that, we were able to get an increase in engagement. We were able to help the families work through crisis, get resources to the families almost immediately. So the engagement and the progress and families being able to sustain has been phenomenal.
That's great, the power of engagement. Thanks, Tanja. Paulita, how's it looking in Memphis?
Here in Memphis, I can definitely say that the pandemic has caused some challenges. We were used to seeing clients on a weekly basis to having to communicate directly through telephone. I will say that we were able to provide clients with laptops, so we are still able now to utilize visuals to see our clients, but engagement definitely has gone up because now clients have the flexibility to attend those sessions. And then also our coming together as an agency, we've been able to partner with other departments within the agency to provide services to families. And I think that that has been beneficial for our clients as well. I know that staff are reaching out on a weekly basis, and clients have been extremely grateful, calling just to say how thankful they are for the extra support, because the pandemic has caused us to be more supportive. It has caused us to be more in their business, if you will, and then being able to partner with other organizations and understanding what they're doing to support during the pandemic, and then building that social capital for our clients. And that's just kind of, what we have been doing in this pandemic. And hopefully we can continue until everything returns back to normal.
Thanks, Paulita. Yes, again, it comes back to that connection, right? And then that's what 2Gen is all about, is connecting people, and we're really speaking to that. Well, we are out of time. This was such a robust discussion. There were so many questions that came in that we did not even have a chance to get to, but I think that really speaks to the interest in everything that is sort of moving in the 2Gen space. So we really invite you to read more about some of the evaluation work that's going on. There's work at Urban Institute on the FCCC Context and Equity Report, so check those out. And also stay tuned for more work that's coming out about the partnership integration brief and the full evaluation report, as well as at Mathematica's site about the Agape evaluation. Please go there and learn more about that. And there's also more resources at the KC website on our FCCC initiative, as well as other information about 2-generation approaches. And we saw some questions about equity training and things like that. And we really would be happy to connect with folks around this. So feel free to reach out to the panelists. And we'd be happy to continue these conversations. I think it's fantastic that everyone is interested in this, and I hope this continues interest and more work in evaluation and evidence building within the 2Gen field and in the space that we have here. So thank you all for attending and engaging in this discussion, and let's keep the conversation going. We need more work here, and it's really exciting that we were able to have this today. So thank you all very much, and thank you to our panelists, and thank you for all of the work that you've been doing. This is fantastic. So have a wonderful afternoon, everyone. Thank you again.